So we're talking about what kind of examinations do I need to evaluate my breathing. There's a couple things we can talk about. The most common way that I look inside someone's nose is with something called anterior rhinoscopy. This is a nasal speculum, and usually with a headlight and the speculum, you can look inside the nose and see a lot of details of what you need to see. You can see cartilaginous deviations, you can see the internal nasal valve, you can see bony deviations and things like the turbinates. There's other things that we can look at inside the nose with, which is with a nasal endoscope. With an endoscope, you can see a little further back, and a nasal endoscope is good for sinuses and determining if someone has large adenoids. You don't necessarily need to use an endoscope with every patient, but some patients do benefit from the use of an endoscope. The other examination, which is helpful, is a CT scan. Again, this is better for patients with sinus problems and other issues. A fourth treatment that's less commonly done is called Rhino Manometry. This is where pressure is put in the nose and you can actually measure the airway. Studies have shown that this not to be as accurate as possible. The ultimate reliability of how someone breathes is going to be based on their subjective feeling, and there's something called a nose score, which you can kind of calculate how someone's breathing is before and how someone's breathing is after. But these are just some tools we use to help examine your nose.